I'm called Jose Nyetera Nyamtamba, and I was born in Gasetsa. Gasetsa is in the Eastern Province, 14 kilometers away from Kibungo. And I was seventh of my family. It was a family of 9 children. It was 1948. I'm 77 now. I did my primary school here in Rwanda. Then I started secondary school here. I think I did 2 years of secondary school here. Then I had to fly and follow my parents because they left me in Rwanda. And I had to follow them. But I didn't go straight to them. I first went where my sister was in Burundi and tried to study again. I studied to continue my studies. I did 8 months only, and my father came to fetch me. My parents were in Tanzania. When they left, I was here in Rwanda. They left me at school. But then later, children who had their parents outside Rwanda were not allowed to continue. Yeah, they said either we have to pay our school fees and to pay taxes of our parents. So it was a way of chasing us. That's how I went again. 3 years later, I joined my parents and I went to Burundi, then joined them in Tanzania. I did nursing and midwife in Tanzania. Then I went to work in Uganda. I worked at Nyakibari Hospital for 2 years, then shifted to Kampala to Makerere University in the sick bay for 2 years again. Then I got married and went to Congo. When I got to Zaire, I got a job in a clinic for at least 4 years. Then worked in 2 pharmacies because I had small children. I couldn't do night duty. And 1978, I started feeling that I have a call. I needed to help suffering people. But I thought I understood it was not in a hospital. It was something else stronger than me, but I didn't realize what it was. Sometimes I could even go just in the city and see if there was no one needing my help. In which way, I don't know. I couldn't understand until I came back. When I came back, that feeling was still in me. It was a desire, a strong desire to help suffering people. But I didn't know which kind of people and where and how. And then I got a job in 95. January 95, I worked for Care Australia. And I was just doing, I was working with another nurse, but an Australian nurse, because they had an accompanied children center at Mushumba Mwiza. That's where we used to work. There, I think we had 100 children to take care of. There was a psychologist working for Care Australia. And once she took me to the near village here in Kigali, in Remera, there was a traumatized nun, I think, and I had to translate. And I translated, and she was satisfied. It was my first time to see a traumatized person. It was right after genocide, because it was in March 95. That time, we had another training with a man, a Ugandan called Kasozi Fred, who was working for Save the Children UK. And he was telling us about fostering and for children, fostering, looking for families, and then reunification. That man inspired me very much. I saw his compassion. I saw how he was committed. And I said, I think I know almost what is the desire I have. That man is inspiring me. I was near the answer, but I didn't know exactly the answer. And I was wondering how Kasozi, Ugandan, can have compassion for Rwandan children. Yeah. So when I came to know his history, he told us his history, then I understood that really he's doing from his heart. So then really I started to think and to pray God to show me the way, until I met that psychologist in Care, Australia. A day after we met, she called me in her office. She was called Jane, but the other name I don't remember. She was Jane. And Jane told me, I'm leaving, but I would like to recruit you for counselors who are going to be trained, because I think you can be a good one. And me, I was just surprised. She said, I'm going tomorrow. Go home, change yourself, and come back. We are going to UNICEF. And we have a meeting there. In the afternoon, we had a meeting. She told them already, I'm going tomorrow, but I leave you this one to be part of the group you are going to give the training. So she had already told my boss that I might leave anytime UNICEF will call me. So she told me, don't worry, I have already talked to the boss. If you need to go to the meeting, if they call you on the phone, you can. But in the meantime, I left my books here. You can go and read. So if you do the interview, you are going to be able to answer. So I was reading some of her books, and then at the UNICEF they told us you should listen to the radio, and then one day we shall call you. I went home, but I was obliged to resign because even that NGO was going to close. So we tried to reunify children with their families, but in the meantime, I left the place and went home to wait for the new training. Then once, actually they called in the radio and we started interviews. That was early 95, but many things happened. There was Ministry of Rehabilitation, Ministry of Health, UNICEF, working together to see how they can open a center for trauma. Yeah, and when it was ready, then they started recruiting. That's where we started to doing interviews. After those two ministries with UNICEF, they were part of people who were listening to us. And there were some psychologists in UNICEF, American, two Rwandese, who came from Belgium but working for UNICEF. So after there was WHO with the Ministry of Health, I think. They did a document. They did a document just to start thinking about that center, like mobile clinic, like a mobile people who can go throughout the country and work for mental wellness. So we started with 7 people. Then afterwards, two or three came to join. So we had a house in Timirongo, at Nsekarije's home. There was a house they were renting, and UNICEF really helped us with, they were paying everything, up to the pen and paper. So we started learning, but intense learning for 2 months. And those helping us were from UNICEF, but they were Rwandese. So the training was there. It was theory and practical. And then we started with theory, slow by slow. We had to prepare ourselves to go on field, but we had tape recorders each. When we go on field or where we learn with our psychologists, we would work, then register our voices, then they would supervise us through that. That's how we did. And then the first phase was sensitization about trauma. And then I think WHO helped the government to rehabilitate the hospital. Yeah, the government of Rwanda in 1995, in collaboration with WHO, made a document entitled the National Mental Health Policy, with the view of responding to this unprecedented challenge, which was the genocide. This document was to facilitate and a question of decentralization, trying to work all over the country. But the government of Rwanda as well established the National Trauma Center in order to solve problems related to magnitude of needs caused by post-traumatic syndromes. So Ndera was to become a national referral hospital. Following the request made by the Ministry of Health, this aspect has been taken care by the Swiss Humanitarian Aid. And where is the congregation of Charity Brothers in Ndera, were the one ensuring the management of the hospital. Yeah. So this hospital was in good condition because they helped to rebuild it. But there is, with this Swiss humanitarian aid, then came a psychiatric who was called Munyanda Mutsanason, with another Swiss nurse who was called Remo Porcher. And they came now to start recruit nurses all over the places and try to do the training for psychiatric nurses. That's how it started. They were studying in their hospital. They brought back those patients who were hidden and those who were still wandering around, and they started treating them. Slow by slow, I think there is one nurse who came from Burundi in the mental hospital. He was working here in Dera and he was still alive, so he started looking for a few medicine to start and work. And in the meantime, the brothers of Charity came. They brought some tablets, and the hospital, slow by slow, became a hospital. And that school of nurses was at Ndera itself. They were trained for, I think, 3 years or something. That time, the phase 1 was sensitization. From sensitization, there was a request for clinic. Those who started to know, actually, Rwandans were mentally sick, but it was before Ndera came, because Ndera was started in 1968. That's when they opened that hospital. Before that, mentally sick people were wandering around, and when it was very, very bad, they took them to the prison. They were taken to the prison and stay there. Clean the surrounding, they give them to eat, and they go back to the prison. That's where they spent the night until those brothers came. And then to come back after genocide, after the sensitization, people were seeking for help. Yes, we know what trauma is. Yes, we know the cause. Yes, we know the consequence, but what to do? That's when we tried to give the report that we need a clinic. We need a clinic. But UNICEF did not, they said they are doing emergency, but they are not ready to do the clinic. Then the Ministry of Health started to think what to do until this Swiss humanitarian aid agreed to support. And as Nason was training those psychological nurses, afterwards, Swiss agreed to rehabilitate this psychosocial clinic, which started in 99, I think. Then that clinic started at Chimirongo, where we were, but for 3 years, and then UNICEF stopped the aid. Then Humanitarian Aid Swiss took over, and they closed National Trauma Center and trained us again to know more about mental health so that we can start a new outpatient clinic, collaborating with Ndera Hospital. So they could treat psychiatric diseases, they could treat medical diseases even. They had a laboratory for cardioencephalography to see the function of the brain and do the diagnosis of epilepsy. And then we had 2 laboratories, one in SAPS and one in Ndera Hospital for this electroencephalography machine. We had 2 in the country. That time we saw that from sensitization we have a clinic. And in the clinic people would come, have good care, and they are cured, and then they are rehabilitated in the normal way of working and living. That was a very big step. but the sensitization had to go on. Even now we need it because people do not really understand that you can be treated and continue to live and work. Actually, we are doing, we have even done a big step because those people can now, we can even know this is this disease and it needs such care and treatment, which was not there before. But before we were very few. Then the university came. They are now learning. They have psychologists. We have psychiatric doctors. They are trying to help with medication, with psychotherapy sessions, with training so that people increase their awareness. If you are aware, it is a beginning of the treatment. Because if you don't know what is in you, then you cannot seek for care. That is a big step. It's a big step, but the way of living as well, there are some people who are still ashamed. Before, it was something taboo, something they don't talk about. Now people start to talk about it. Before, it was hidden. Even the clinics were, asylum were very far from rural areas where people live. They were very far, but now that's why our clinic was in town near the girl, because people should demystify mental health. People shouldn't stigmatize. It's an illness like any other which can be treated and get cured. If people understand that, then it's a gain for the country. But now we see many young people being sick. The way of living as well has changed. Now the work we do, they want it to be done in a little time with one person who has to do many things at once, and lots of information at once. Social medias, you have to learn, you have to work, you have to know your family, you have many things which needs a better organization. Now I can say that, like here, Solid Minds work now with universities. Post-genocide trauma actually, like let's say in 2002, that's when we started seeing very bad reactions during the commemoration. And we were very few. We didn't know what to do. And sometimes you would see like a bus coming full of school girls or boys, school girls. They would come like 16 at once, or unconscious, or very conscious, but with too much sadness, too much emotions, difficult to deal with. And we were very few. So sometimes on the 7th, on the 13th with Chichuchiro, we used it to work from 6 p.m. up to 5 next day, and we go and sleep for an hour and come back to work for the whole day. So it was very hard. Sometimes we would go to Kie and take some students. We would do trainings with police, ARG, Red Cross, so that they can help us during the commemoration. And they did quite well. We used to put tents. They would come and help us to do the first care. And those who are in bad conditions, they take them to the clinic. All was coming to SAPS, it was too much for us, but as years grew, we learned to decentralize. Then we had a group in SAPS, we had a group in Dera Hospital, we had a group of Seashika, we had a group in Faisal. They could go in those places so that we can deal with them. As years grew, we used to have more places to help them. We tried to decentralize, and that is what is helping the country actually. Because like RBC, they continue the training as well. In district hospitals, we have a psychologist, we have now a psychologist, a mental health nurse, and psychiatrists are not many, but at least psychologists and mental health nurse there is in each district hospital. So this helps because they can be helped there, and those who are bad off, they bring them, they refer them. The awareness as well increases the number of people who seek for help. That is one. But then there are some people who try to look for answers elsewhere, like in smoking marijuana, drug abuse is something raising now in the country. People trying to, the mental problem can come from it, or you can take it to calm the problem, vice versa, a way or another. Sometimes it is the drug which comes first, sometimes it is the illness which comes first, and you take the drug to try to calm. But when the drugs comes in, then it becomes worse. Now we have a big center in Butare for drug abuse. There is Ndera Hospital, there is Kinyinya, or they have specialists who try to deal with those cases. Even Chizere, they deal with. Even here, any clinic of mental is dealing with that. It is linked with many things, many things. First of all, there is the education, basic education. We know that in Rwanda, this has been disturbed as well. There are some children who have never had parents and who were not allowed to be children. They are asked to be adult before time. That can weaken the person. And you will see the results later. There are many children responsible for other children. There are many who are not allowed to be children. They have to be adults, behave like adults, take care of your brothers and sisters, and sometimes you sacrifice your studies for them because you have to behave like a mother and work like a mother and a father at the same time. All those are challenges we cannot ignore.
What's the government's role in this? What should?
They do many things in this because they tried to look for shelters for them. That is something very big. Shelters. There is FARJ. FARJ has helped a lot. If FARJ didn't exist, I don't know where this country should be. Because you had so many children to take care of who are now giving their testimonies. They became men, and some are married, some have children, and it went well. Really, FARJ was, I cannot know how to say, it was something which came in time. It's FARJ, like, it's like a family, it's like parenting those children in the right way. Mental health issue is a suffering like any other suffering. It should not be seen like something of shame. If it came because there was a reason. and it is their right to be treated, and they can get cured and be rehabilitated in their everyday work. Not only treatment, but there is a way as well of, there is a way of preventing. Like we say, prevention is better than curing. If people are aware, if their awareness is raised, if it is high, then people should seek for help in time. The better, the earlier you come, the better it will be. If they come in time, they can be treated and things go well. And they shouldn't be stigmatizing, they shouldn't be something which is shameful. We are all candidates. It can happen to you and to me and to any other person. That's why we should not be afraid to ask for help. If we ask for help, things will go well. And we cannot talk of progress in our country if we don't talk about good mental health. And that's why I said now, here in Solid Minds, their awareness is to the youth. They are focused on universities because that's where there is too much work, a lot to do. And those are tomorrow's Rwandans, tomorrow leaders. If they know how to do the wellness to themselves, to take care of themselves, to prevent those, they can prevent a bad mental health and build a good mental health. Even if you are strong mentally, then you can go ahead, and they learn how to do it. Physical exercises, whenever you have negative thoughts or negative feelings, it's better not to sleep with that. It's better to get rid of it and then start another day tomorrow with a good fresh mind. And this is done by taking care of ourselves, and that's what Solid Mind is teaching them, to take care of themselves as prevention and as curative.